Hello. Today's topic is going to be on substance abuse in teens. Okay. Now, what is this substance abuse? So, basically, you must have heard about drugs, alcohol, and all these other things. Yeah. So, substance abuse is this. Okay, tobacco and all that stuff. Now, do you know that teenagers or the substance abuse is usually starts in the teenage? Most of the adults, around 70% of adults who are on substance abuse have started it during their teens. Okay, so the teenage is a very important time. Okay, now what can this substance abuse do? Substance abuse can predispose the child to so many risks. Okay, it has high risk behaviors. Now high risk behaviors like
risky sexual behavior, HIV, hepatitis, road accidents, violence, crime, suicide.
so many. Okay, also we should know that suicide is very common in alcohol abusers. In addition, substance abuse predisposes the teenager for severe, that is heart problems, liver problems, and also cancer problems. Now, what are the three basic causes of substance abuse? So the three basic causes are, one, the most important is peer pressure. अरे मैंने लिया है, कुछ नहीं होता, ले ले, बहुत अच्छा लगता है. Okay, अरे so many of them are doing. You are still a child, why don't you do that? Okay, or maybe, oh, you know what, a smart boy or a handsome boy or a smart girl or a smart girl or a sexy girl or a trendy girl is going to do this. ये तो not trendy, you're not doing it, it's not trendy. These are the peer pressures or the peer pressure of the other children telling them. Second thing is genetic predisposition, wherein the family is already having such people and the child has been seeing this type of behavior in the house. And the third is the desire to experience. Now, what is this desire to experience? If I tell you in medical terms, it will sound something like this.
The immature brain of teens, where limbic system matures early, is ready to seek rewards against the control system, that is prefrontal cortex, which makes teens vulnerable to drug abuse.
So, bouncer, right? Okay, so in easy words, it is a zing to try something new. मुझे करना है, मुझे इसका experience लेना है. I want to do this. Okay, so that is that zing that they want to experience. Now, what are the flag signs that you may know that yes, my child or some teenager around you is into drug abuse? I will put up a whole list here now. Okay, so let's go through it. So first is the efforts to mask the smell. Now what does this mean? So basically the child will try to use a lot of mouth fresheners or the perfumes to mask the smell. Okay. Second thing is avoid the eye contact and the hugs with the parents. Third is a new set of senior friends who were never there earlier in his life. A social isolation, that is loss of interest in activities enjoyed earlier. A scholastic deterioration. A child who was otherwise very well to do is suddenly showing a deterioration. Third is an altered eating habit and a sleeping pattern. Then next is the increased conflict with the parents due to unexplained irritability. For even minor things, the teen will start fighting with the parents. Unexplained stealing of money and valuables at home. Okay, so these might be the various symptoms that the parents may note or the various signs that the parents may note. Now, what are the spots? That is, how you can spot, yes, the child may be into so and so drug. So, amnesia. Amnesia is just the teenager just forgets what happened yesterday. Okay, this might be a date rape drug. Okay, this might be one of the reason that the child has amnesia. Blackouts, like, suddenly the child is, मुझे कुछ समझ में नहीं आता. Okay, blackouts. Okay, this might be because of the alcohol. Red eyes, maybe because of marijuana. Chest pain or tachycardia. Tachycardia is increased heart rate. They will say palpitation, that is बहुत ज़्यादा धड़कन है, heart beats very fast. This might be the reason. Amphetamine or cocaine. Constipation may be because of marijuana. Increased craving for sweets may be again because of marijuana. Now let's see how do we tackle it. Now the whole list of how do we tackle it is right here. Okay, and I'll explain it to you. So parents have to be goal oriented. Okay, don't expect your child to be the best. Okay, set a goal and the child has to reach to that goal. Second is provide a loving and supportive environment instead of fighting with the child and trying to give him big gyan, okay, too much of gyan about what is the ideal and some other child is doing this, you are not doing that. Instead of giving that gyan, be supportive and loving to the child. Be a role model. Now, don't expect your child to be the role model if you are not one. So, if you are already into drugs or alcohol, don't expect your child to not to follow you. The child will follow you. Use authoritative parenting style, that is, don't give up to the children's expectations and children's demand every now and then. So this authoritative parenting style should start from the childhood of the baby itself. You have to also set clear limits, that the child can do this but not this, and this also should start from earlier. Teach life skills, very very important. You have to start with age appropriate house chores at a very earlier age, at around 5 or 4 years of age, so that the child knows the life skills which are involved in that. Monitor the use of media and peer group. Okay, somewhere the child might be seeing some media which is not age appropriate, maybe with the peer group which is again not age appropriate. You have a realistic expectation. Develop a communication skills. Communicate with them easily in a friendly manner. Enhance their self-esteem and assertive skills. Okay, so they have to be assertive. If I'm saying no, I don't want to do it, I don't want to do it. How much ever the peer pressure is there, they should be assertive that I do not want to do this or I do not want to experiment this. Ensure a healthy lifestyle, a sleep and a media hygiene. Now, all these things that I told at the end are very very important, and remember, these cannot be done in 1 or 2 days. It is, Rome was not built in a day. Okay. Similarly, all this final step that I told, that is how to tackle, you have to start from the time the baby is small. So it is very very important that the child rearing practices are good. Okay, child rearing practices involve lot of communication with the children and the, I mean, lot of communication between children and the parent. Okay, and also a clear thought expression between the parent and the child. I hope I could get across all the message to you regarding the teens and the drug abuse. I know this is a very short and a concise video, because if you know, it tell any of the doctors to talk about teen and abuse of drugs, it's a long discussion which can go on. This was a very small message I wanted to give you during International Adolescent Health Week, and yes, we are celebrating it from 21st to 27th. Bye bye.